Mr. Chairman. Medicare ended up costing 12 times more than what was predicted after its first 25 years of operation. The costs of Medicaid exploded even more than that. As Chairman Jordan mentioned in his opening statement, the estimated costs for Obamacare and now the Unaffordable Care Act are now double or triple what was originally estimated. All the other Federal medical programs have gone far beyond what was originally predicted with the lowball front-end estimates. And, of course, Speaker Pelosi was famously quoted as saying we'd have to pass Obamacare before we could find out what was in it. But the more we find out, the more complicated, confusing, and convoluted it becomes. And we're told we have to hire 16,500 more agents for the Internal Revenue Service to enforce the law, and possibly thousands of navigators and assisters. But I want to go in a little different direction, and that's the solicitation of contributions by the Secretary. The Washington Post story on this says, but the industry official who had knowledge of the calls but did not participate directly in them said there was a clear insinuation by the administration that the insurers should give financially to the nonprofits. Meredith McGee, Policy Director for the Nonpartisan Campaign Legal Center, which researches government ethics issues, said she was troubled by Sebelius's activities because the Secretary seemed to be, quote, using the power of government to compel giving or insinuate that giving is going to be looked at favorably by the government. The New York Times story said, but several executives said they were uncomfortable with the discussions because the Federal Government has the power to approve or reject the health plans they want to sell in insurance markets that will be run by Federal officials in more than 30 states. Health care executives said they were reluctant to make big contributions for several reasons, including the fact that insurers are required to pay more than $100 billion in new taxes over the next 10 years to help defray the cost of expanded coverage. Drug companies must pay new fees totaling $34 billion over the same period. As you can see, my main concern, Mr. Cohen, are the costs. But do you know, did the Secretary request a legal opinion about the propriety of soliciting donations?
You know, I can't speak to the specifics of what the Secretary, any conversations she had or what she did, because I don't know. It sounds like the person quoted in the story doesn't know either, because they say they weren't on the phone, but they just heard about it from somebody else. What I can tell you, though, is that during Medicare Part D, which was put into place by a previous administration, the Department worked with a wide array of groups, including AARP, Pharma, the National Alliance for Hispanic Health, the National Association of Area Agencies on Aging, to do outreach and to help people get enrolled in coverage in Medicare Part D. That's what they did with Medicare Part D. It's called a public-private partnership, and it can be a very effective way of reaching out into the community and helping people learn about a program and what it can benefit for them. That particular partnership, which was called La Promesa, operated to do one-on-one outreach in 17 different states. So that's what they did with Medicare Part D.
All right. Let me ask you something else that Chairman Jordan mentioned. He mentioned the loss of jobs and the fact that many companies are cutting people's hours back so they don't go over the 30-hour limit. And once again, the Washington Post had this, said because of this, Cook Medical, Boston Scientific, Stryker Corporation, Medtronic, Covidien, and Zimmer companies have all cited the medical device tax as the reason for building plants in China, Mexico, Ireland, and Costa Rica, and for laying off hundreds of U.S. workers, 1,000 in the case of Stryker. Several of these companies, possibly all, have already planned charges against earnings ranging from $50 million to $175 million. Have you looked into this part of the law?
I'm not familiar with what those companies have done or the decisions that they've made, no.
All right. Before my time runs out, how many different companies and unions and businesses and governments have requested waivers from the law, and how many have been granted?
I would have to get you that information. I don't know it off the top of my head. The only waiver program that we had was a waiver from the annual limits provision to allow companies that offered coverage to their employees to keep that coverage until January 1 of 2014. But I couldn't give you the number. But it's on our website. I know that.
Okay. Thank you very much. My time's up.
I thank the gentleman.